Well, a new study, this wasn't actually a study, this was a report that the United States government is giving $500,000 of your taxpayer money to academic institution in California to come up with a better way to propagandize the use of Guardasil, which is the HPV vaccine that they want to give to your teenage girls, the HPV vaccine that they want to give to your teenage girl. And because people don't like vaccines, and rightly so, because the pharmaceutical companies don't give us the correct information about the pros and cons of vaccines, and all we get is the party line. Oh, don't look at the man behind the curtain. Don't worry about that Vioxx stuff. It's perfectly safe and no problemo whatsoever. And meanwhile, 500,000 people die. Nobody goes to jail. There are no court hearings. Nobody's wrists get slapped. Maybe there's a little fine here or there. But are you kidding me? 500,000 people dead, and we still go to the altar of the MD. We still listen to what they have to say. There are over 30 medical devices and drugs which were approved by the Food and Drug Administration as safe and effective for you to use, and they kill people. They kill people. And now there are class action lawsuits against them. So how can these two things be equal? How can we have a fair and equitable scientific board whose job it is to take care of the health of U.S. citizens, and they have such an unbelievably horrible track record? Well, there's only one reason that any of this can happen. It's because of a monopoly. The medical industry doesn't care about your health. It cares about profits. 100%. It's a 100% profit-driven runaway juggernaut. And, you don't know this. You think, oh, no, it couldn't possibly be that, but it is. Your medical doctor isn't going to spend $150,000 for medical education, devote 16 years of their life to a particular methodology and then abandon it overnight because it kills people. They're not going to do that. Oh, every once in a while, a rare individual does do that. Every once in a while, a rare individual steps up. I went to school with a couple of MDs who got so frustrated with conventional medicine that they wanted to become naturopaths and, dip their toe in that water. I've got immense amount of respect for people like that. But they're the exception. They're not the rule. They're the exception. They're not the rule. This becomes reality by consensus. MDs just continue to play out the party line. They continue to play out the party line. Oh, Guardasil, that's an okay thing. Oh, the influenza vaccine, that's a safe and effective thing. And then they're not. They're not. We do not have an objective party. We do not have an objective party that's measuring the effectiveness of this stuff and that has your back. We don't. Dr. Wallach and I do. Naturopathic doctors do. A handful of chiropractors do. A handful of committed holistic physicians around the country have your back, but we're also in the minority. And, that's why we didn't form it, Dr. Wallach formed it. That's why Dr. Wallach formed his company, Longevity, as a networked business. And I've got to tell you something. Dr. Wallach caught a lot of crap in naturopathic circles when he decided to form his company as a network business. Because 17 years ago when he did that, everybody looked down their nose at network marketing. Oh, that can't be a good thing. Oh, no, we can't do that. We can't have people making themselves millionaires with hardly any overhead. We can't do that. Huh. Dr. Wallach took a lot of crap, but, every dog has his day, and it's starting to roll around in our behalf. As we were talking about yesterday with Mike Randolph, if Obamacare is implemented, and remember, this is not a political show. I voted for President Obama, but if Obamacare is implemented, it is going to drive people into conventional medicine more than they are now, and that's going to change everything because the doctors who are the MDs now, because remember, it's a for-profit industry, the MDs now are starting to get away from accepting Medicare and insurance payments, and they're going to a cash basis. The same way that they do in Canada. If you're a Canadian citizen, you get socialized medicine. It's baked into the cake. They take it out of your check every week. There's nothing you can do about it. And then that gives you access to socialized medicine where you have to wait for a long time to get care, and then it's the standard nonsense MD allopathic reductionistic party line. If you want to do anything different, You can hire a private doctor, but you have to pay cash out of the pocket for that. Well, that's what's going to happen in the U.S. Now, when people start paying cash out of their pocket for medical care, the free market opens up, and they're going to start to look around and say, hey, you know what? I think the naturopaths are getting way better results with their stuff than the MDs are giving me with their stuff for chronic disease. So you know what? Thank you very much, Mr. MD. I ain't going to give you my money. I'm going to give it to Longevity instead. I'm going to give it to Longevity instead. I'm going to learn how to become my own doctor with science-based, clinically verified medical therapeutics that actually work, that are actually science-based and clinically verified, actually unbiased science. Now, there hasn't been a whole lot of unbiased scientific research happening in this country for quite a number of years. You don't believe me? So here's what I want you to do. I want you to call up your local medical university. Whatever it is, whatever state you live in, there's a university in your hometown that, prides itself on delivering the best education for doctors in the world. I want you to call up their research department. It's public information, by the way. It's a public university. I want you to call them up, see what research they're working on, and see who's funding it. See what research they're working on and see who's funding it. The pharmaceutical company funds all of it. The pharmaceutical industry funds all of the medical research that happens in the United States. So, there are a couple of foundations like the, Norma and John Clark Foundation for the Advancement of Medicine. But even when you get private foundations funding research, because it's done at allopathically directed hospitals, it's allopathically directed research, which means it's all drugs and surgery all the time. It's all drugs and surgery all the time. And by the way, when pharmaceutical companies, spend $60 million to research the particular effectiveness of a drug, they do all the research in-house. So they'll do 30 different, experiments to prove on this particular new drug that they've rolled out. And when 10 of those experiments are successful, but 20 are unsuccessful, they only publish the successful ones. This is how things like Vioxx get approved, and then it ends up killing people. And not only Vioxx, but over 30 other drugs and medical devices approved by the FDA as safe and effective for your use kill people, and now they have class action lawsuits. Well, I guess the legal industry, it's good for them. It's good for the lawyers. It's good for a handful of those lawyers, who make the lion's share of the kill. Get the lion's share of the financial kill when they actually can successfully sue a drug company. But 10, 20, 30 million bucks to a drug company, that's a drop in the freaking bucket. And so we swirl and spiral down into madness because we've let the idiots drive the bus. Well, idiots isn't the correct word. We've let the monopolistic dictators drive the bus. MD-directed medicine is communist. It's communistic. It is. Because MD-directed medicine argues that you aren't smart enough. Your body is not smart enough to take care of itself, just like communist dictatorships argue that the society isn't smart enough to take care of itself. People have to be managed by the intellectually superior state, and the state organizes and orchestrates everything that happens to the populace, and the populace just comes along for the ride because it's the small 1% of the 1% of the intellectually elite who really know what's best for everybody, and this is what you have to do. That's what communist dictatorships do, every single one of them. Well, that's what MDs do. They don't think your body can fix itself, so they deliver a drug to your body, the intention of which is to override, overpower, and control the machinations of your human body. It's to control your inherent biochemistry. They're not trying to fix anything. They're trying to take it over. It's a hostile takeover by a drug. It's a hostile takeover by a drug. For goodness sake. This is what we give our hard-earned money to gain access to. And now this is what President Obama, to his shame, is telling us that we all must do. It's mandatory now. You have to buy access to medical insurance. That's the leading cause of death in the United States. You have to buy access to medical insurance. That's the leading cause of bankruptcy in the United States. You have to gain access to a medical system under whose guidance obesity has skyrocketed, Alzheimer's has skyrocketed, arthritis has skyrocketed, autism has skyrocketed. You got to be kidding me. This is the blind leading the blind. ladies and gentlemen. Now, my recommendation, cancel your comprehensive medical insurance, buy catastrophic medical insurance instead, and use the money that you save every month to get on board with the Healthy Start Pack, the appropriate Healthy Start Pack, a couple of bottles of selenium, a couple of bottles of Z-Radical, whatever it is that you need in order to support and promote your body's built-in, inherent, God-given ability to fix itself, and stop eating the 10 bad foods. This is a really good recipe for health. It's much better to build your health. That's a much better insurance policy, don't you think? Building your health step by step every day rather than keeping your fingers crossed and hoping that you don't get sick. I mean, isn't that why you buy medical insurance? Because you think, holy crap, I'm going to get so sick I won't be able to afford it. Well, it's time to stop that insane mindset and be your own advocate. Get on board, not with anything you find on the internet. Get on board with medical nutrition, boilerplate health recovery formulas formulated by licensed and regulated naturopathic physicians. This is our wheelhouse. This is our skill set. This is what we bring to the table, and you would be well advised to pay attention to what we have to say, for goodness sake. You know, there are experts in every field of human endeavor. There are some people that excel way more at what they do than the rest of the herd. And I'm here, it's God is my witness. In the wonderful undiscovered territory of naturopathic medicine, Dr. Joel Wallach, my colleague, mentor, and friend, the founder of Longevity, is the unrivaled superstar. Take Dr. Wallach's advice at all costs.